Welcome to the Lone Star College Polysomnography information session. My name is Jordan Rusk. I am the program director, and this presentation will talk a little bit about the field of sleep medicine, the role of a sleep technologist, and the information needed for the application process, and a little bit about the program itself. So what is polysomnography? You've probably never heard the term, but you may have heard someone who has sleep apnea or they use a CPAP machine. And so polysomnography is an allied health profession, and we learn how to run different sleep studies and some of the treatment options as well, depending on what the patient is diagnosed with. So as sleep technologists, we are helping physicians diagnose and treat patients with various sleep disorders. And during a sleep study, we are monitoring really everything from head to toe, so we can get a good idea of what is going on with our patient's sleep, what is making them not feel rested or put together, feeling well, and then how can we help them with that with some of the treatment options. So we're looking at brainwave activity, and we're looking to see if the patient is awake, asleep, and what stage of sleep they're in. We're looking for muscle activity in their legs, potentially their arms, and in their chin to see if they grind their teeth or have muscle activity when they shouldn't. That's a certain sleep disorder. We're looking at their eye movements, their breathing, oxygen levels, their heart rate and rhythm. So as a sleep technologist, we apply all of the electrodes, and we also run those studies as well. So a sleep study is completely non-invasive. Everything is surface electrodes that we put on our patients, and it is usually done at night. There are some daytime tests depending on what the physician is looking for in the patient, but it's predominantly done at night, and it allows us to really get a good picture of what is going on with your brain, your body, your breathing, your oxygenation while you're sleeping. And so we're looking at those sleep stages. Are you getting the appropriate amount of each sleep stage? What does your breathing look like? Are you having any sleep disordered breathing? And how is that affecting your oxygen levels, your heart rate, your heart rhythm, potentially your carbon dioxide levels, depending on the patient's age and what they may be looking for. We can tell if they're snoring. So again, we're looking at a lot of different things to be able to help that physician diagnose a patient with a sleep disorder potentially. So here's just some images. We do put on a lot of electrodes. In the program, you will learn how to apply all of these electrodes in the first semester, as well as be the patient. So you'll be able to see what it feels like to actually have all of these on and try to take a nap. So it's usually not too hard to get the patient to go to sleep, because a lot of times we're dealing with patients who are very tired anyways. And if you put everything on in an appropriate way and a nice, safe way, it shouldn't be too uncomfortable for the patient. So here's just an example of what a sleep study one-page sample looks like, and you will learn to read and interpret all of those squiggly lines. So they all mean something. The top are brain waves, and then we have our heart, we have our leg movements, we have our snoring channels, and our breathing. And so not only do you learn how to apply all of the electrodes and run the studies, but also help read the studies as well, which we call staging sleep and scoring the study. So there's different types of sleep studies depending on what the patient's symptoms are. And so these are all the different types that you will learn while in the program. So a polysomnography or a PSG is kind of your typical overnight diagnostic. Let's put everything on, get a good idea of what's going on with you. A multiple sleep latency test is done during the day, and that is looking for narcolepsy or idiopathic hypersomnia, where patients are just very excessively sleepy, but they don't necessarily have narcolepsy. So it's a series of tests that we do throughout the day to see how quickly do they fall asleep, and if they fall asleep, how quickly do they go into REM sleep. PAP titration, so if someone is diagnosed with a form of sleep disordered breathing, the gold standard treatment option is a positive airway pressure titration. So we can perform those in the sleep lab. The technologist, we fit the patient with the masks, we run the studies, and we actually do those titrations, and then the physician looks at the data to determine an appropriate pressure for the patient. And then home sleep apnea testing. This has become much more popular, and there are different types of home sleep apnea testing. And so we have some of those types here at the college so that you can see what those look like and be able to see the pros and cons to home sleep apnea testing for our patients. So sleep has become a really popular topic in the health and wellness space. And so that is really great for our field and career because it is a relatively newer healthcare field. There is a ton of research in sleep right now, and we know that sleep directly affects a patient's physical health as well as their mental health. And so getting not only enough sleep, but good quality sleep is very, very important for long-term health benefits. So patients with sleep disorders that are left untreated are chronic health conditions like they can develop heart disease, high blood pressure, diabetes. They're at higher risk for stroke, sudden cardiac death. Their quality of life is reduced. When we don't get good sleep, we don't feel great, right? We're grumpier, we're cognitively, we're not as sharp on things, and there's an increased risk of accidents. So whether that be workplace accidents, car accidents, just making mistakes that you normally otherwise wouldn't make. And so currently there are over 85 types of sleep disorders, and they're broken up into kind of 6 categories. And so this is something you will also learn. Not all of these need an in-lab study. Some of these can be diagnosed through just the physician talking with the patient and seeing kind of what their symptoms are. But there are a lot of different sleep disorders that a patient could potentially have. As a sleep technologist, we wear a lot of different hats, and it is going to kind of depend too on where you work, the different responsibilities that you have. But we do prepare our patients for the sleep studies, so we do all of their intake paperwork, we explain the procedure to them, we apply all of the electrodes, and then we're also monitoring and recording that data. So a sleep study needs to run for at least 6 hours, potentially more, depending on the patient's age, the kind of study that we're doing, things like that. And so we are monitoring them throughout the night to make sure, one, that everything stays on and we have a good quality recording, and if we need to intervene in any way, that we are right there paying attention to our patient as well. We can help physicians with the analyzing of the results, which we call sleep staging and scoring. So learning how to read those squiggly lines, determine what sleep stage the patient is in. We also mark if they have any respiratory events or anything like that. We will help with that as well. And then we're also doing a lot of educating. So we're educating our patients on proper sleep hygiene. If they're there for a PAP titration, we're explaining what that is. We're helping them understand the importance of that treatment option as well. So as a sleep tech, since we do work at night, a lot of it is you have to be able to work independently and critically think. There are usually not physicians right there. There's usually not nurses or respiratory therapists. A lot of times we are by ourselves or with another sleep tech, depending on how many beds the sleep lab has. So we really need to be good at critical thinking and making decisions and understand what we're looking at so we know when something is an emergency or when something maybe isn't. Also, compassionate patient care. We're putting patients in a really vulnerable position. We're asking them to come somewhere strange. We're going to put a bunch of electrodes on them and we're going to monitor them all night long. So not only are we monitoring what's coming from the electrodes, but we also have a video on them and an intercom so we can hear them as well. So we need to be very good at making our patients feel comfortable, making them understand the importance of why they are there. And then as well as having technical proficiency. So everything we do is on the computer. We do teach you all the things that you need to know about running the softwares and troubleshooting, but having that technical proficiency and just understanding technology is a benefit to you as well. So here's just some more samples of sleep studies and what you will learn how to interpret while you're in the program. So we are an associate's degree program. It's Associates of Applied Science in Polysomnography. We start a new cohort every fall, and the program is 4 semesters long. And we will be the 3rd college in the state of Texas to offer an associate's degree in polysomnography. So our curriculum includes everything you need to know to learn how to become a sleep technologist and really prepare for your board examination to become registered at the end. We are a 60 credit hour program. It is a full-time curriculum. All courses are held at the Kingwood campus. The classes are during the day on campus, and then clinicals start in your 2nd semester, and clinicals are predominantly at night. There will be a few day clinicals sprinkled in there so you can see the role of a day technologist, but our job is predominantly at night, so your clinicals will be night shift clinicals. You will need reliable transportation for all of your clinical experiences. We typically send a student by themselves or maybe with one other classmate, depending on what the lab can handle. So you do need to be able to have transportation to get you to and from clinicals. Again, our coursework is done on campus in Kingwood and then at off-site clinical locations. We have a 6-bed sleep lab here on campus that we will do a lot of our labs in and get you ready for clinicals. And then clinical rotations start in your 2nd semester, and they are 1 to 2 nights per week, depending on the semester, and they are 12-hour shifts. When you graduate, you'll have a little over 1,000 hours of clinical experience, and your clinical rotations will be in both adults and pediatrics. Once you graduate, you are eligible to sit for that registry board exam. Our credential is pretty unique in that it is accepted worldwide, so you really could go work anywhere with that RPSGT credential. Starting pay that we're seeing in our area is anywhere from about $28 to $33 an hour, and then hospitals have that night shift differential because you're working at night, and our pediatric hospitals tend to pay more because those patients usually are a little bit sicker and need a little bit more attention to detail, so they pay a little bit more. Like I mentioned earlier, sleep is a very, very hot topic right now in health and wellness, so there is a growing demand for our career. There's just more awareness in the importance of sleep health. Patients wearing wearable devices like Apple Watches, Fitbits, the Oura Rings. There's so many consumable wearables that give patients data give them a sleep score, give them their oxygenation, their heart rate, and that is a lot of times what is bringing patients to their doctors. And then their doctors are in turn having them do a sleep study to kind of see what's going on to get a better picture. So that is bringing more patients to the sleep lab. We also have an aging population, right? If people are living longer, and so with that becomes more health conditions and rising sleep issues. And there are a lot of advancements in treatment options for sleep disorders. Historically, you had CPAP. That was pretty much your only option. Now, there are different modalities of PAP therapy depending on what kind of sleep disordered breathing pattern you have. There are implantable devices now that help stimulate different nerves to help with obstructive sleep apnea. There are dental devices, mouthpieces that patients can wear if their issue stems from something in their mouth or their jaw. So there are more options to help treat these different sleep disorders as well. So when you graduate from the program and you get that RPSGT credential, you will work nights as a night sleep technologist, and that is traditionally 3 12-hour shifts per week is considered full-time. If you like the educating side, interpretation, so sleep staging and scoring aspect, or you want to get into management, there are day sleep tech roles that comes with experience as a night tech, and those are more traditional 5-day-a-week, 8-hour shifts. There's options to get into research. Like I said, we're really expanding into different implantable devices. There are hospitals that do clinical trials on some of these implantable devices, so you could get into the research side of things. There is an additional certification you can get in becoming a clinical sleep health educator. And so that's another option. You can work for a DME company doing mask fitting and education, and then there are sales as well that you can go into. So our program, there are 3 prerequisites that are required to be considered an applicant for our program. These have changed and they will be effective this fall of 2026 application period. So it's A&P 1, English 1301, and then Sociology 1301. There are 2 other general ed courses built into the program. If you have those ahead of time, I highly recommend it. It will give you more points on your application, and it will free up your time while you're in the program. So that is A&P 2, and then any class from Core 40, which is Language, Philosophy, and Culture. The ideal student for the polysomnography program is someone who is truly passionate about being in healthcare. We develop a very strong rapport with our patients. We're spending a lot of time with them. Again, they're in a vulnerable position. We're asking them to sleep in a strange place and let us watch to figure out what is going on with them. This is a shorter program, so you do need to be able to have good study habits and move quickly since we get everything done in those 4 semesters. Our program is also unique because we do not deal with needles, bodily fluids, anything invasive. So if you want to help patients, but maybe you don't love that aspect of healthcare, this is another great program for you as well. So it's also great for people who maybe don't know what they want to do. They want to get into healthcare, but maybe don't want to be a nurse or don't want to be a respiratory therapist. This is a great way to get experience in the healthcare industry, get that credential, and then if you do decide whatever you want to go do, it makes you a more ideal candidate for that program. You already have healthcare experience, you already have a degree, you already have healthcare credentials, so that will make you stand out against other applicants as well. This is also great for adult learners who maybe are looking for a second career or never really had a career. Maybe they stayed home or did kind of on and in jobs and want a career. This is a really great one. It's not physically taxing on the body in terms of you're not running around the hospital. You're in the sleep lab, and we do a lot of observing for the majority of the night. The hardest part on the body is just working nights. There is a little video. I will let you watch this on your own. This is from Texas Children's Hospital, one of their sleep technologists, and just explaining how he got into the field and what he loves about it. So you can watch this on your own. So becoming an applicant, you need to be at least 18 years old at your time of application. If you are not a student of Lone Star College, make sure you apply to Lone Star first because you will need a student ID to be able to complete the application. If you have courses from any other college or university outside of the Lone Star system, you will need to make sure you submit those to our admissions office. We do require all of our applicants to take a health science reasoning test. And so this is a 33-question multiple choice test that measures your ability to critical think. So you do not need any prior experience or knowledge in sleep. It is all just critical thinking questions. It is $15 and the link is on our webpage. You will need to take this through our testing center, and then your scores are sent to us and we will upload the score to your application. It usually takes about 2 business days for the scores to get to us and then for us to put it into your application. Our application period is open from March 2nd to June 1st. There is 2 ways you can get to our application. So one is on the polysomnography page. There is a link that will say apply here at the top of the page, or you can go to the health occupations application page and find polysomnography. All of the correspondence about your application, acceptance, waitlist, denial will be sent through your Lone Star College email. Nothing will be sent through your personal email. So make sure you are checking that regularly because if we have any questions about your application, it will be sent through your Lone Star College email. Here are some pictures of our lab here on campus. Like I said, we have a 6-bed sleep lab on campus. Each bed is kind of set up like little cubicles, have sleep equipment so that we can run the studies similar to a sleep lab here on campus, and you can get lots of practice before you go to clinicals. And if you have any questions about the program or the application process, please feel free to email me. That is the best way to get an answer. It'll be the quickest way because I'm not always in my office at my phone. So please send me an email if you have any questions. If you are applying to the program, make sure you fill out the information session form that you watched it and include that with your application. And I hope to see all of your applications. And again, if you have any questions, please feel free to reach out.